All right, thank you so much, everyone, for being here. We're really excited to present today's webinar. I looked at the list of folks who are joining, a great list of great people, and I'm pandering to the crowd here. I think there's going to be some people that are intimately familiar with this topic and others that will be the first time hearing about it. So I'm going to try my best to meet in the middle of those who know everything and those who want to learn everything. So appreciate y'all again being here. And here we go. All right. So I'm Jeff Temple. I'm the director of our Center for Violence Prevention. And just a real quick shout out to breaking the cardinal rule of PowerPoint here with too many words on the screen. But this is, just want to introduce you all to our center here. We've been in existence since 2019. And our mission is to prevent violence by collaborating with academic, public, and governmental partners to develop and implement evidence-informed screening, prevention, and intervention programs. And we have wonderful faculty and staff and folks supporting us. Dr. Baumler up there is our director of biostatistics. Shannon Gio-Wright is our director of health policy research. And Leela Wood is our director of evaluation. I don't have several other people that I should be mentioning here, like our associate director, Liz Torres, Dixie, who's helping me out today, and just tons of other folks that make this happen and make me look better than I am. So thank you all for, if you're listening and on the call. All right, so here's a picture, a couple pictures I took at a mall a few years ago. This was in Spencer, so it's basically in every single mall in America. And you can see the first one, bitches be tripping, or maybe I pushed one. The other one, bite me, beat me, whip me, and fuck me. So both of these are very clearly espousing and supportive of violence. And of course, you have other things like this is a bad image of Grand Theft Auto, which is you can actually have sex with a prostitute, pay her, beat her, and get your money back after you beat her or kill her. So we see that we have a mountain to climb in terms of preventing dating violence and really preventing these negative thoughts, attitudes about women and men, as we'll come to find out here in a little bit. So there's different types of dating violence. I think the one that most of us think of when we think of dating violence is physical abuse. So this is hitting, pushing, scratching, biting, hair pulling, arm twisting. But there's other forms that are equally as, or maybe even a little bit more so in terms of troublesome and consequential. So psychological, emotional, verbal abuse, that's often put on the back burner as that's just psychological abuse. But really the data shows that is maybe even more consequential than physical violence. So, that old saying, sticks and stones may break my bones, but words will never hurt me, really needs to be flipped on its head. It seems to be that those are the most scarring in terms of saying that you're worthless and you're useless and you're fat and you wouldn't be anywhere without me and you're lucky to be alive and all that sort of stuff. That seems to have the more long-lasting consequences than a bruise or broken bone, as terrible as that is. There's sexual dating violence. This is anything from sexual coercion, which we see quite a bit, which sometimes doesn't even break the legal barrier, but it's have sex with me, have sex with me. Why won't you have sex with me? If you don't have sex with me, I'm going to send the picture of your breast that you sent me to everyone in school. Then there's cyber abuse, and we really don't necessarily think that cyber abuse is a distinct form of abuse. It seems to be a vehicle by which people use to perpetrate the other forms of abuse. So psychological, for instance, demanding passwords, or not believing where the person is and having them take a picture to prove that they're with Jenny and not out somewhere else. In terms of sexual abuse is kind of the example that I said earlier. Send me have sex with me, or I'll send the naked picture you sent me to other people. So how common is it? Well, it's quite common, and these numbers are a bit deceiving, and I'm going to tell you why here in the next few slides. But through countless studies for several decades now, we have shown that about 25% of teens will experience some form of dating violence prior to graduating from high school. And repeatedly through the Youth Risk Behavior Survey, which is done every other year in high schools throughout the United States, we find about 1 in 10% of teens are in physically violent relationships by the time they graduate high school. So again, I'm going to come back to this. We can skip that busy slide. And here's basically what we've done. We started in 2010 with a study called Dating It Safe. And with that, we have followed the same 1,000 teens for the last 11 years and are actually going to continue following them for an additional 4 years. And recently we were able to add their partners to the study. Yes, I just saw Amber, the slides will be made available, and I need to not, I'm bad at responding to questions as they come on. So Liz, tell me to shut up when I do that. So yes, the slides will be available. So basically this Dating It Safe study, we followed the same cohort since 2010, 1,000 kids every year. And we've been looking at things like risk and protective factors of dating violence, the consequences of dating violence, what's associated with dating violence, all that sort of stuff, so we get a better understanding of how to prevent it. And here's the prevalence that the 12-month incidence, the prevalence of dating violence throughout the study. So this is year 1 to year 8. We have done a couple more since then, but I haven't updated the slide. And you can see that it ranges between 22%, 16% and 22%. And that seems scary and alarming, but what is even scarier is this next slide, which is this is the cumulative incidence of physical victimization over 8 years. So what this is saying that after year 8, and this is when kids would have been, well, I guess they wouldn't have been kids anymore. They would have been about 23 years old. So year 1, they're on average about 15. Year 8, they were 23 years old. And you can see by the time they were 23, 55% of females, 55% of males will have experienced physical victimization. So over half of our sample, by the time they're 23 years old, have been physically victimized by a dating partner. And this is a fairly novel data because a lot of folks have this idea that, okay, the prevalence of violence is 30% or 25% or 20%. Well, that's because how we've collected data, including myself, is like, okay, what's happened in the past year? And then the next year, what's happened in the past year? But when we look at it cumulatively, this is pretty alarming stuff. And it's repeated over and over again. This is among people who had no physical violence at baseline when they were 15 years old. So by the time of those folks alone, 40% of them had been physically victimized by year 8. All right, here's some more, and I'm going to get to that question, Margaret, Claudia, or whoever asked the question about non-binary youth. There it is, trans and non-binary youth here in a second. Cumulative incidents of physical victimization. So this is by the item. So, when we first did this, we're like, okay, maybe they were not endorsing the severe items. So we separated by items. Threw something at them, 34% by the time of year 8. Kicked, hit, or punched, 34%. Slapped, pulled hair, 29%. Pushed, shoved, or shook, over 37%. So this is again and again, what we're seeing is if you look at it cumulatively, a third of these are experiencing pretty severe physical violence. And sexual victimization, similar thing. Here, this is just 2 items scale over 8 years. 17% of females by the time they're 23 have been sexually victimized, 9% of males. And then forced sex items, so rape, this is the sample, 10% by the time they're 23 have been raped. All right, so who's at risk? Pretty much everyone. That's the easy answer. So it doesn't matter what socioeconomic strata, what ethnicity, what gender. In fact, we see in a lot of samples that males are as or even more likely from an adolescent standpoint to be victims of violence. Now, that doesn't mean, I don't want y'all to throw anything at me. That doesn't mean that it is a male problem or that we have this huge problem of female to male violence. Not necessarily. It's still that women are still the ones that are more likely to be sexually assaulted, psychologically abused, and injured, most importantly. But I will say that we do a disservice to girls and women when we ignore female to male violence, because we do know that violence begets violence. So this is not a blaming the victim or blaming self-defense or anything like that. I just think that when we teach healthy relationships, we need to teach both men and women and girls and boys how to both, prevent perpetration and prevent victimization. So we do know this gets a little bit to the question, to Ellen's question about trans and non-binary youth. I will say that the research on those groups is really, it is just not a lot out there. This is a couple studies that we did on LGBT kids, and we basically found that it is, especially with sexual minority youth who identify as bisexual, they seem to have the largest risk with our studies. There's been other studies that show that gay populations LGBT populations have an increased risk. And not only that, but it might be qualitatively different. So in addition to the normal physical, psychological, sexual violence, there's also different types, like outing your partner as a form of psychological abuse. So it looks qualitatively different as well. We definitely need more research on trans and non-binary youth. My guess, unfortunately, is that they have a higher incidence of dating violence, given the stuff that we know about them with other risky behaviors. So who is most at risk? Well, we know that this is important, because if we can figure out who's most at risk, then we can tailor and target these kids a little bit more in a targeted fashion. So we know that those with risky behaviors, we've done studies where it's shown that alcohol is longitudinally and drug use is longitudinally related to physical dating violence perpetration. So this was a study we did, the same Dating and Safe study, that when they were freshmen, if you used alcohol and drugs, you were substantially more likely to perpetrate physical dating violence over the next year than those who did not use substances. And that was even after accounting for their earlier use of violence. So that's important from let's target substance use as a way to prevent dating violence. And I'm going to get more to that, sort of targeting multiple problem behaviors as opposed to sticking with just our silos. So another one is exposure to community or interparental violence. So we know this is a huge risk factor for perpetrating and being a victim of dating violence. And we did a really neat study that this needs to be updated. This is cross-sectional data. But we saw that witnessing, for both girls and boys, that witnessing mother to father violence was important in predicting TDV perpetration. So that goes more to what I'm talking about is when we ignore female to male violence, we do a disservice to girls and women. And why might this be the case? Well, if mother to father violence is happening, maybe it's a sign that just more severe violence overall is going on. More consistent violence. Maybe it is that children spend more time with their mother than their father. They identify them with more, so they're more likely to mimic that behavior. Regardless, we did find that mother to father violence was important in predicting girls and boys' perpetration of dating violence. Another part that was interesting about this study is that we found that it wasn't just that simple, that if you witness your mother to father violence, then you're going to perpetrate dating violence. No, that's just not the case. So tons of people witness their parents in abusive relationships and go on to have healthy, happy relationships. What we did find was that the acceptance of dating violence is what explained or mediated that relationship. So if you saw your parents, violence between your parents, but you knew that it wasn't acceptable, maybe you were taught in school or had good role models or friends that it wasn't an acceptable way to resolve conflicts, then you are no more likely to perpetrate violence than someone who didn't witness their parents use violence. So here's another article that we did, and I mainly just put this one up because I like the response to it. But it is, what we found here was that spanking or corporal punishment was a predictor of future physical dating violence. And this was a pretty neat study for me. And you know, I was working out one day at the gym and I got a CNN notification on my phone. And it was cool because it was my study that was being covered, and I had no idea. I just got the, you know, the alarm on my phone, and I looked at it and I was like, hey, that sounds like, oh, it is my study. It was pretty cool. It was covered in the Atlantic and CNN. It was less cool in the sense that it was covered on all these media sites, and that the website and the Facebook page that y'all may have heard of, I effing love science, but they don't abbreviate effing. And they covered it, and they had it. And within, I don't know, 30 minutes, there was 35,000 comments on it. And I would say that most of them, and I read them all because I'm, you know, full of myself. And as I read them, I realized that 90% of them were bullshit, 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 bullshit. So I really had to have some thick skin on that one. But it was pretty interesting. People did not think that it was related to future dating violence, which is pretty silly to me. You know, it's silly to me, and of course it is, right? I mean, we've known that we are likely to repeat behavior that we have learned in our lives. And, you know, if we have learned resolving conflicts with any form of violence, you're going to be more likely to try to resolve conflicts with violence. I mean, it makes a lot of intuitive sense. Now, that being said, I probably explained it to the media horribly, or at least that they picked up on it horribly. And so when we say more likely, it doesn't mean that if you were spanked as a kid, as many of y'all were, as I was. I tried to spank my daughter once and she laughed at me, so I stopped because I couldn't do it hard enough because I was scared. But what it means is, so you have 10 people, that's 10 kids that weren't spanked. Maybe one of them goes on to perpetrate dating violence. Then you have 10 kids that were spanked, and 2 of them go on to perpetrate dating violence. So in that case, it is 100% increase. So that's what I should have done a better job of explaining, that yes, it's more likely, but no, it doesn't mean that if you spanked that it's the end of the world. It just means more likely. But you can see these folks. Who was the little whipping boy who conducted that study? That was me, Robert. And this is my favorite. The author of this article needs to be spanked. That was by Ted, who spells his name with 2 D's, which, you know, I think is weird, Ted with 2 D's. Okay, so in another study, we looked at childhood physical abuse. So getting away from spanking and actual physical abuse. I shouldn't say actual because, you know, but anyway, childhood physical abuse and its relationship to dating violence and young adulthood. And what we found here was really kind of interesting. It was the effects of that early childhood physical abuse that explained whether or not a person was perpetrated physical dating violence later on as emerging adults. So if those, essentially those who had PTSD, likely a result of that childhood physical abuse, those were the ones that were most likely to perpetrate dating violence in emerging adulthood, which is important from an intervention standpoint, because if we can, you know, if we know what is we're not going to stop all childhood physical abuse as much as we all want to, but if we can prevent the consequences, that would go far. So if we know that if PTSD is a indirect cause of future dating violence perpetration, then we can target our interventions on reducing PTSD, on helping kids and young adults process some of that, what happened to them as children, and deal with the symptoms of PTSD. All right. Lastly, this was a really one of my favorite papers. It's a study that was published in Pediatrics, and we basically set up an algorithm for predicting teen dating violence. And what we found out was that physical dating violence was predicted by, these were the most salient predictors, I should say. So there's a lot of other predictors. This is not an exhaustive list. It's just when you looked at their relative import of each of the variables, these are what we came up with. So exposure to domestic violence between your parents was hugely and not surprisingly predictive of physical dating violence. Maltreatment, deficits in conflict resolution. So again, if they don't know how to resolve conflicts in a healthy way, that predicted physical dating violence perpetration. Sexual dating violence was predicted by a violent dating history and acceptance of dating violence. So important to get these salient predictors so we know how to target our interventions and what to target. All right, consequences. I used to spend a lot of time talking about the consequences. And in fact, that's how I first started out in this field, is looking at domestic violence and the very negative consequences of domestic violence. And I got kind of, it's important to know the consequences, but they're bad. It's just, there's no two ways about it. It's horrible. And if you look at basically every physical, psychological, social aspect of people's life, it's negatively affected by being in a violent relationships. You're more likely to use substances. You're less likely to do well in school and in work. You're more likely to have a host of psychological problems, depression, anxiety, PTSD, and poor physical health, not just broken bones and bruises, but your immune system is compromised when you're constantly afraid of being abused. And then, of course, you have things like you yourself may act aggressively, and then low self-efficacy, hugely important. As a psychologist, efficacy is really, really important to me. It's not the same as self-esteem, whether or not I think I'm good. It's whether or not I think I can do something. So if I'm in an abusive relationship and I'm told I'm worthless and stupid and can't do anything, well, then my self-efficacy is going to be sometimes literally beat out of me. And so I don't think I even can be in a healthy relationship. I don't think I can leave this unhealthy relationship. So the hugely consequential. And probably the most important with respect to prevention is we know that dating violence is a massive predictor of future dating violence, future partner violence. So what I really want to do is focus on preventing dating violence, not only to make teens' lives healthier and happier, but to make their future lives happier and healthier and less likely to be in violent relationships. If you look at all this stuff, it costs the US taxpayer billions of dollars, domestic violence does. So even if you don't have a heart and don't care about victims, we know that we can financially save a heck of a lot of money by focusing on prevention and investing in prevention. All right, so what can we do about it? I told you how it was a problem, how big of a problem it was, what are the consequences. So what can we do about it? So there are, I'm going to talk about one in particular. There are other evidence-based solutions, but this is one I'm going to spend most of the time, the rest of the time on, is this thing called 4th-R. And a lot of y'all on the phone or on this webinar have heard of this, but it's the 4th-R stands for relationships. So it's reading, writing, arithmetic, and the last R being relationships. Now, never mind the fact that 2 of those don't start with R, and we'll let that part go. But basically what this is it's focusing on teaching kids how to be in a relationship. We teach kids everything. We teach kids how to ride a bike, how to play a musical instrument, how to dribble a basketball, how to science and math and history and basically everything. We teach kids everything, and then we should continue teaching them everything. But I can't believe we don't teach them how to be in a relationship. Probably the most essential thing what it means to be human, the hardest thing to do, and probably the most predictive of what makes us happy and healthy is relationships. And we don't teach them how to be in a relationship. It's crazy to me. It's basically like if we gave kids a basketball when we were trying to teach them basketball and said, okay, go play, and never told them anything about it. That's what we do with relationships, right? And their role models and how they learn is not very great. If you look at it, the media, I put those 2 examples earlier, it sucks. Parents, even really well-intentioned parents, are sometimes not the best role models for relationships. Oftentimes, parents will get in an argument in front of their kids, but then they'll make up away from their kids. So their kids never get to see even how good parents resolve conflicts in a healthy, happy way. And conflicts are going to happen. They learn from their friends, and friends are just as bad as they are. So most of them learn by trial and error. And you know what? The fact that we don't teach relationships and they are still okay at it, the fact that, you know, a half of them will not be in a violent relationship ever, that's kind of impressive in the fact that we don't teach them how to be in a relationship. I do want to go beyond that in some of this, and I'm probably jumping ahead a little bit. I think we should focus as much on promoting healthy and happy relationships as we do on avoiding unhealthy and violent ones. You know, it's not good enough to just avoid violence. Let's get healthy and happy relationships, sexually positive relationships, and you know, I think that's our job to do as well. So with Fourth R, one of my favorite things about it is there's other good dating violence prevention programs. Safe Dates is a great one, for example, coaching boys into men, shifting boundaries, dating matters. There's some other ones that have been shown to be effective. What I really like about Fourth R is it targets multiple problem behaviors by addressing the shared risk and protective factors of those. So it's not just a dating violence prevention programs. It's preventing risky sexual behavior and substance misuse and bullying and fighting. And so it's really, you know, an efficient way to prevent a lot of negative things that are happening with our youth. And right now, and not the school's fault at all, but right now we're going about it all wrong. So we have an assembly on dating violence. That doesn't do anything. It's not going to be effective. We have Red Ribbon Week, where it's a week where we talk about substance misuse. Well-intentioned, but it's probably not going to do anything. We have someone come in and talk about bullying. Probably, you know, it sounds good, but it probably is not going to have an impact. It's not going to be effective. And so we have this effective program, and I'm going to talk more about that effectiveness here in a second, that targets the shared risk and protective factors of all those problem behaviors. And really what that's targeting is relationships to, if we can promote relationships and improve relationships, then we can do a better job of preventing a lot of these problem behaviors. So we need to get out of our silos, I guess is what I'm saying. And for those of y'all in Texas, there's the Christine Blubaugh Act that was recently passed, which basically requires school, of course, that's unfunded as most things are, but it requires school districts to address healthy relationships. And so this is a way that we can address healthy relationships while also preventing a bunch of other things. So the curriculum, again, it's based on healthy relationships. It replaces, it doesn't have to, there's other ways to go about it, but basically it is focused on these 3 curriculum units. So 21 lessons total, one on violence and bullying, healthy growth and development, substance use prevention, and then it's the Christine Blubaugh Act, SB 9. And so someone just asked a question if you guys thought I had Tourette's or something. So we have these different things. Then we also have an optional healthy eating. So we went in, we would give these folks this curriculum that they really liked. You know, folks who often teach health class are the coaches, and the coaches want to coach because that's what they were trained to do and hired to do. And so we'd give them these units that would talk about these that they really liked, but they also had to teach eating and nutrition. And so this way that we had we added some additional elements around nutrition, healthy eating, which still managed to weave relationships through it. I'll also say that at this point that Fourth R meets all the federal standards for health class, and most state standards, including Texas, the TEKS, it meets all the health standards with a couple of different things, like it doesn't teach CPR. Some other points about Fourth R that I liked. I talked about the strength, the skills based. I talked about the positive youth development. I talked about relationships as core. The other part that I really like about it is that it's universal in nature. So we don't target quote unquote bad kids. And I think we would all agree that they're not necessarily bad. If you're bad in 7th grade, it's probably not because you're a bad kid. It's probably because other stuff's going on. But what it does is instead of targeting these quote unquote bad kids and putting them with other bad kids and making them all badder, we don't do that. So this is the universal focus is a plus because it puts pro-social kids with kids that need a little extra help. So there's some scaffolding model where they can learn from each other. It doesn't stigmatize, these bad at-risk kids. And the other part that is good about it, like I said before, is that it's not just about avoiding violent relationships. It's about promoting healthy and happy relationships. And again, relationships are core and built in throughout it. Here's an example lesson. Yes, Neva, Neva, I will do that in a second. And you know what? I'm just going to shut up and do the questions at the end, and so I keep going. And that's my fault. So here's an example of a grade 7 activity. So this is Unit 1, Lesson 2 from Unit 1. It's on bullying and harassment, and basically they're given this format. It's not all filled in, and they're asked to. The students are told to identify the different types of bullying and harassment, and then within those to identify what would be an example of verbal harassment, what would be an example of social, that sort of thing. And then they talk about it among themselves and they pick it up. There's other examples are how to apologize to someone, how to break up with someone. So these really real life examples, and I hate myself for not mentioning this. Another great thing about 4th R is that, and other effective prevention programs, is that there is a focus on role plays. And so it's not just a didactic thing where we're telling kids that substance use is bad and that alcohol is bad and that violence is bad. They know all that. They've been told all that. So rather than just doing the sort of didactic way, we have these role plays where they can practice ways to resolve conflicts, for instance, in a nonviolent way, where they can practice breaking up with someone, where they can practice apologizing to someone. And so that way, if they practice it in class, when they get into the real world and real environment, they can replicate what they've practiced. All right, so what we've been doing with 4th R, we've had an implementation study funded by the Centers for Disease Control, in which we implemented in several high schools, the high school version, which the high school version has been found to be effective in a Canadian sample in reducing dating violence perpetration. We've also partnered with the city of Houston, and we did a 2-pronged approach there, where we went into high violence zip codes, and we did 4th R in the classrooms, and then we did a thing called crime prevention through environmental design in the environments around the high school, with the idea of preventing violence in those areas. And both of the above 2 were implementation service type grants. We've also worked with Dr. Gio Wright and Bianca Aubignon, worked on the trauma-informed education, to where we can go through 4th R through it with a trauma-informed lens and a racial equity lens, and to change wording and change terms and change the examples to be more appropriate for kids who have been through trauma, for kids of color, and then lastly is this what I'm most excited about, and what we'll talk here quite a bit about, is this cluster randomized trial of middle school version of 4th R. And what cluster randomized trial means is basically it's an experiment that we've all learned back in science class in school. So we had 24 middle schools participate. 12 middle schools did their typical typical health curriculum, which their health classes, sometimes some of them are good depending on the school districts, but some of them are based on, the textbook is from 2005, before smartphones even existed. There's some of the health classes, a food pyramid, where we're allowed to eat like 11 servings of bread per day, which is pretty awesome. But a lot of them old school, right? And so those 12 middle schools, they had their typical health curriculum. And then we had 12 middle schools that were, again, randomized. And so they had the randomized schools, and the control schools had basically the same makeup of students with respect to ethnicity and socioeconomic status. And With these other kids in the intervention schools, those kids received the fourth R. So again, 12 schools made about 1,200 students received the fourth R. 12 schools, about 1,200 students received the standard health curriculum, and we found it to be effective. So this consort diagram here, you don't need to worry about it. It's a lot of words and all that, but just how we identified the schools and the students and how we randomized them. But at the end of the day, what we found was that after only 1 year, so this is from 7th grade to 8th grade, we found, and not a whole lot of time to make a difference, we found that those who were in 4th R schools were less likely to perpetrate adolescent dating violence than those in the control schools. So 14.9% to 18.3%. Significant. That might not seem like a huge number, but again, this was after only 1 year. So what we're hoping to do with our follow-ups is to see that that has an enduring effect, and hopefully even as kids start to date more and even have a chance to be in a dating violent relationship, we hope that these results become even more robust. What teachers are saying about it: eating right is a big deal, relationships are a plus, and right now 4th R is on target. Our head principal likes the program, sits in class, brings together the real life experience part with the role play and skills to the knowledge. I'll say there's also one of my favorite examples here is there is a teacher at one of the schools with 4th R. It's very dynamic. There's a lot of moving around. It's not that same sort of didactic stuff and role playing. And the other teachers would walk by and say, "Man, you guys are having too much fun," or tell the teacher, they're not learning anything. They're having too much fun. And then like a month went by, and these teachers that were saying to the other teacher that he's having too much fun, we're like, "Hey, these kids that are in this class, they're starting to use language that sounds like they're learning stuff, like healthy relationships or just stuff that they wouldn't necessarily be saying otherwise." And so they started to get jealous and wanted to use it. And kids, didn't expect like health to be fun or interesting. If my friends were in it, they would make better decisions. I'm actually learning a lot of things that I kind of actually want to know. I think that last one's really important. We want to do this in a kid-centric way where they're actually learning stuff and wanting to be there and wanting to learn. One of my favorite kid examples of this is probably not the best example because of you'll see in a second, but it was a kid in the 4th R class that witnessed a fight between 2 other girls. And it was a pretty nasty fight with blood and everything else. And she filmed it. So that's the part that she probably shouldn't have done to begin with. But after filming it, she remembered one of her lessons and she deleted it instead of posting it to social media. So, it maybe took a second to click, but it ended up working and helping in that sense. All right, so I saved a good amount of time for questions, and it looks like there are some, and I'll go through them in a second. This is just my favorite quote. It's a little bit outdated in terms of being sexist, but if you're going to do anything for the common man, you have to start before he becomes a man. And we need to keep doing batter intervention programs. We need to have services for women and men in violent relationships. We need to keep focusing on that in college and career paths and workplace violence. But really, we got to stop before it gets to that. We have to focus on prevention. We're not going to, I'm being a bit tangential now, but unfortunately, school shootings are going to continue to happen. Access to guns is plentiful. So what we need to do is really promote these healthy relationships in order to prevent not only dating violence, but all these other problematic behaviors. So here you can connect. I'm actually super embarrassed to say that is the same suit and tie that I am wearing in that picture. Luckily, I wore a white shirt today, not a blue shirt, or else it would have been even worse. But you can see ways to connect with our center through email, phone, and Twitter and Facebook and the website. So, all right, I'm going to go through some of these questions. Is that the best way we want to do it, Liz or Dixie? All right, so that okay, trans non-binary youth, we did that. So does the historical trauma of slavery to the behaviors of spanking and degrading language, does curriculum make this connection? No, it's a really good point. And I think it's something that can be done with future iterations of this, because I think that is incredibly important to consider, especially for these folks that have not only being currently marginalized and facing discrimination and racism, but this intergenerational discriminations and racism. And we know now that trauma can be inherited, that the effects of trauma can be inherited. All right, let's see. All right. Slides will be made available.
And real quick, Jeff, before you move on, we got a message from Dr. Alexander, April Alexander. So hello, thanks for joining us. And she mentioned that Stacy Patton's work discusses the corporal punishment enslavement connection to that previous comment.
Oh, awesome. Thank you, April. And for those who do not know April, she's outstanding. And she was our keynote a couple years ago, I think the first year of COVID. And she stepped in and did a fantastic presentation for us about her lived experiences in some of the protests for Black Lives Matter protests. So thank you, April, for making that connection. I like JC, the science lab partnerships are probably the only non-extracurricular activity that teaches partnership. That, I never even thought of that. That's really important. And if we really want to hammer it home, probably an excellent example to teach healthy relationships or to model healthy relationship skills, which actually brings me to another thing that I think we need to be doing a better job of, is not only teaching these kids healthy relationships, but teaching every single person that interacts with them indirectly or directly. So that is the cafeteria staff, the bus drivers, the teachers, the administrators, the principals, everyone that interacts with these kids. We should be teaching healthy relationship skills. I was going to mention this. So the program profile for the 4th R on the NIJ site notes that multiple program evaluations revealed no effects on actual outcomes. Can you elaborate on 4th R outcomes? So I did do that with our thing, and I am aware of that, and I'm actually in the process of whatever the right word is for protesting that, or are hoping that they can amend that. So with our recent study that was published in Pediatrics, where we did find that perpetration was reduced in the intervention schools. All right, so we got Stacy Patton. Okay, so the policy brief is great and connected with this team. Okay, yeah, so that's where I recognize your name. Yeah, so we have a policy brief out there, and Ms. Fuentes contacted us about this information, and specifically with San Antonio. And yes, I'll be sharing that with you with more of that. Right now, there are no San Antonio schools that we're working with. We're working with folks in the family violence office there, and hopefully that we can connect them with that. All right, are there other, what am I missing? Oh, so thank you, Lauren, for that, and nice seeing you on here. So the question is, what does the 4th R program explicitly or implicitly state is the root cause of teen dating abuse? One of the things that I just wanting to take a step back for a second. And when I first started researching this area, I thought I was super brilliant and the first person to think of the fact that, why do we have these silos? Why not we prevent a whole bunch of problem behaviors by targeting shared risk and protective factors? And it turns out that David Wolf and his team, who created the 4th R, beat me to that by several years, and other people did as well. So I know that with respect to 4th R and its creation, a lot of it is based on the theory of social cognitive theory and learning behavior. But I would also say that it is really the focus is on relationships, and so the negative relationships and how those are formed is what's going to be a predictor of these multiple problem behaviors. So from a theoretical standpoint, if we can improve the relationships, we can prevent a lot of these behaviors. Okay, someone said, if I'm a youth advocate at a domestic violence agency in Kansas that would like to bring this to the schools I interact with, how would I go about doing that? You know, Caitlin, thank you so much for asking that question. Dr. Leela Wood, who helped me put together this webinar, told me that I should have had a slide about this. And so I apologize, Leela, if you're paying attention, because I forgot to add that slide. So basically, if you can contact us at any of these ways, preferably the email violenceprevention@utmb.edu. We can walk you through it. One thing I also failed to mention is that it is a train the trainer model. I talked about coaches, but because it's that way, it's fairly inexpensive. The materials itself are inexpensive. The training is pretty inexpensive. The expense comes down to if, and you should, but evaluation. Okay.
And Jeff, I just want to briefly plug and piggyback off Caitlin's question about Fourth R's smaller group program that targets similar piggybacks off Fourth R called HRPP, Healthy Relationships Youth Program. And so this might also be of interest for those at domestic violence agencies or who work with groups of people in a smaller setting that can have a little bit more one-on-one interaction. And this is not necessarily meant to be in a classroom, but facilitated through a small group.
Thank you for saying that, Liz. That was the other thing that Leva made sure that I mentioned, and I didn't. Yeah, that's right. So and it's more focused, like Liz said, on high risk population, but it also is less sessions. And one of the benefits of it is it's not a closed group, so that you can be so different people can enter it at different times. Yes, the Expect Respect is another, sorry, I'm looking through the chat. Expect Respect is another great program that I failed to mention. Neva asked about the support Lynn for schools looking to update and implement Fourth R. Yeah, so the PAPA curriculum, so they're saying they're currently using H&W by Scott and White. I know that program. I don't think anyone's ever shown that to be, not that it's not effective, I just don't think anyone's ever shown it to be effective. Proper curriculum, I think you have to do. I think that's state mandated. That's a parenting class. But we actually have for Fourth R, we have a pacing guide where we can include Fourth R and things like the PAPA curriculum and the CPR class that is also mandated as well. So we have, from an updated standpoint, when we brought it over to the US and we started doing it with the US, we did some easy updates like change references from hockey to football. We also have from our video examples, we worked with our local high school here in Galveston to where the students created, wrote, filmed, and edited the videos to go along with some of the lessons so that they look like our kids and not Canadian kids. All right, and I think that a couple of people asked for the program that's for smaller groups. It's the Healthy Relationship Plus program, so HRPP, and you get any of that information available by shooting us an email. All right, any other questions? Can we open it up for voice questions, Dixie, or is that not possible? It's probably not possible, huh?
If people raise their hand, then I can unmute.
Okay, so if anyone wants to ask a question or anything, I guess now's the time, or we can give you 9 minutes back in your day. All right, seeing or hearing none, thank you all so much for being here. We really appreciate it. We're excited about this work and hope to be bringing you all some additional results in the near future. Thanks again so much for being here. Really appreciate it.